Hello again. Today I'm going to talk about the chapter 35 on COVID-19. When I wrote this chapter, we were in the midst of a pandemic and there were a lot of deaths and a lot of hospitalizations. The hospitals were strained, all the beds were full. There was pictures of morgues being full, of these huge burial sites, especially New York City comes to mind, but Italy as well. There was a lot of suffering and death. So COVID-19 is a virus. It's a coronavirus. It came to attention in 2019 in Wuhan, China. There was controversy whether this virus originated in a research lab or whether it just originated in the population. Was it associated with these open markets of different animals that are sold in China? There was a lot of blame laying, some on China, some on Fauci, Dr. Fauci of the NIH, because the Republicans were claiming that he helped fund this research group in Wuhan, China, that then developed this virus that got out of the laboratory. It's really not clear at all. But we do feel like China has tried to cover up the story about the virus developing in Wuhan, China. At any rate, China took its time about isolating the virus, and a lot of flights out of Wuhan, China were still going on, and the next thing you know, the whole world had to deal with COVID-19. This virus ended up causing a lot of political division, and a lot of statements were made and conspiracy theories, some of them along political lines, in order to try to gain traction against the other group and win elections and power. This caused a lot of trouble because then the real tasks that needed to be done to try to control this virus were really put, it seems like, it was put on hold or delayed because of this. I think mostly delayed. There were a lot of misstatements made. The president at the time took it upon himself to act like he was head doctor and tried to promote treatments that were not really good treatments. They were false. There was a lot of backlash against Dr. Fauci. There were death threats against him. Instead of following him and supporting him, he got the opposite effect. We had the president talking about Clorox. He made a misstatement there. People were injecting Clorox in their bodies. They were getting sick from that. The president was advocating chloroquine. There was a man who ate chloroquine that was intended for koi fish and died in the intensive care unit. There was a lot of misinformation about vaccination, and anti-vaxxers were on the rise. They were trying to come up with conspiracy theories and did that there were microchips in the vaccine. They were tracking everybody, trying to lock in on paranoia. There were suicides in the medical field. There was a prominent ER physician who committed suicide related to all of this. There were people that were spitting on healthcare workers. They were, these are the people they should be kind to, because they're the ones who take care of their loved ones that would end up in the hospital. There were people that weren't getting their vaccinations. They weren't using their masks. We had politicians who were saying absolutely the wrong things and stupid things as well. We had one politician trying to uh, put a comparison to polio. How many breakthrough cases of polio are there, quote unquote? Well, it turns out that polio vaccine has been a real success, but despite that, before that happened, you had FDR, our 32nd president, who was in a wheelchair related to that. A lot of people were on iron lungs. So polio vaccine was a real boon to mankind. Also, diphtheria was killing children. You, as a parent, you would watch your child choke to death. Smallpox, with its 30% mortality, has been eliminated. You had a politician from Alaska saying it would be over my dead body, I will get a shot. Well, she had already had COVID a couple of times and survived. And a lot of the politicians who were anti-vaxxers had already been vaccinated for COVID-19. So there's a lot of duplicity, a lot of conspiracy theories, a lot of political lies that were going on to try and gain traction there. The hospitals were overwhelmed. People needed to take their vaccines to try and let the hospital take care of those that were there, and people that didn't have COVID-19 actually suffered because all the beds were occupied by COVID-19. You come in with a heart attack and now you're in this long line. So there was just an awful lot of things that were going on that were really a disgrace and terrible situation. We had RFK Jr., who's now our health director, who said that people that had to use mask and vaccine requirements had it worse than Anne Frank, who died, of course, in the death camps, Nazi death camps. He later apologized for that. We have a lot of people saying idiotic things, and we really needed to be listening to Dr. Fauci. They were trying to discredit him, give him death threats. And now we have the CDC directors that really are more friendly to the president and his agenda. And some of that agenda, of course, has to do with anti-vax, has to do with vaccination, and they're against vaccination. And so we have an anti-vaxxer, RFK Jr., who's now who's our healthcare director. So this is all, I think, disgraceful. But it's very important that we try to follow the guidance of people who are really expert in infectious diseases and know who is saying what. That's critical. We know that about 7% of Americans who've had COVID developed long COVID, and that could have been prevented with the vaccine. At the time I wrote this chapter, about 1 million people had died of COVID. About a third of them, it's thought, could have been saved with vaccination. So with that, I'm going to go ahead and close. Thank you.